What are our sinuses? Our sinuses are bony filled sacs within the skull, and you can see two of them here, the frontals and the sphenoids, but there are the two more between the eyes, the ethmoids, and below the eyes, the maxillary. When these sinuses are inflamed, hence sinusitis, the linings inflame, they secrete fluid. So already one of the symptoms is a nasal discharge, because all of these sinuses drain into the nose. But if these sinus openings themselves are blocked, you can get a positive buildup of pressure within the sinuses by pus, by fluid, and that will cause headaches. They can present as pain in the front, behind the eye, underneath the eye, or at the top of the head. What are the causes of sinusitis? Usually, commonly, they are viral. That means you have a viral cold, the nose is inflamed, the openings of the sinuses draining out are blocked, and the sinus gets secondarily infected. They can also be bacterial, and this is usually secondary to long-term allergy problems, or secondary to a viral infections, or sometimes there is in fact an infective source, like the root of your teeth. Usually that would relate to the maxillary sinus, because only some of the teeth have their roots within the maxillary sinuses. Sinusitis is diagnosed by taking a good history. A patient has a runny nose, has a cold, has facial pains, and the pains are classically in the head, below the eye, and for sinus pains particularly, it gets worse when they bend over to tie the shoes. It can be diagnosed by x-rays. It can also be diagnosed by CT scans, which shows the entire skeleton of the face, both outside as much as inside. It can also be diagnosed with an endoscope. These are special telescopes that can be put into the nose, and you can actually see the sinus openings inflamed and maybe even discharging pus. How is it treated? Because these sinuses drain, the best treatment is to improve its drainage by using topical nasal decongestant that open up the nose, allow it to drain, by using normal saline douching to wash away all the dirt that's inside, and by using antibiotics, particularly if it's a bacterial infection, to treat the underlying cause. Sinusitis has two phases. The first phase is what we call an acute infection. You have a cold, the sinus gets inflamed, you get facial pain, you recover, and that is one episode. Hopefully, it will never come back. But sometimes, the infection is severe enough that the openings of the sinuses are blocked. Or the way that your facial skeleton within your nose causes it to be blocked even more. If the infection cannot clear itself completely, you may therefore have what we call a chronic infection. We call it chronic sinusitis. When that occurs, then usually pain is not the biggest feature, but repeated infections. As you can see from this model, the complications that one gets from sinusitis relates to where it is in relation to other vital structures. The sinuses are inside the skull. Therefore, they are adjacent to your eye, and therefore you can get eye problems, eye abscesses. They lie in front of and underneath the brain. Therefore, you can get brain inflammation, brain abscesses. Thankfully, none of these are common, but if they do happen, they do constitute an emergency. If the inflamed process continues, it is quite possible that the patient can enter into the next phase of inflammation called chronic sinusitis. With chronic sinusitis, the sinus lining is continually or episodically inflamed and therefore infected. They will suffer from regular discharge from the nose. Often that's pus, therefore they may experience what we call cacosmia, that is a bad smell. They may get fever, although that is not a usual presentation. An endoscopic examination will see inside the nose that pus is building up and draining from the sinus openings. The treatment for chronic sinusitis is extremely simple. It is all targeted at draining the openings of those sinuses wherever they are. And this is usually done by surgery with endoscopes targeted at the openings inside the nose. A new form of surgery called balloon sinuplasty, similar to the angioplasty that dilates the heart vessels of the heart, that surgery can also be used. And again, they are directed at opening up the sinus openings.
Fine Doc, your doctor is here.